Hi, I'm Dr. Prashanth Adiga, Professor and HOD of Father Muller's Medical College, Mangalore.
Who all are at a greater risk of developing benign prostatic hyperplasia.
Okay, being a male and age older than 50 years, and if somebody is having a family history of BPH, they are at a risk of developing BPH, and certain health conditions such as obesity, metabolic syndrome, diabetes, hypertension have a higher risk of developing BPH. And lack of physical activity can also lead to increased incidence of BPH in older men. And black and Hispanic men have a higher risk of developing BPH.
What are the various tests which can help diagnose benign prostatic hyperplasia?
So BPH can be diagnosed based on the symptoms. It is usually diagnosed based on the IPSS score or AES symptom score, which can lead to symptoms like urgency, frequency, incomplete emptying of the urine, and hesitancy and intermittency, and nighttime frequency. These are the initial symptoms of the BPH. And based on the symptoms, we do ultrasound abdomen to know the prostate size and the post-void residual urine. That is, after urinating, how much urine is remaining, and also we'll be able to know the upper tract dilatation. That is what we call hydronephrosis. And also we'll do a PSA. The value of the PSA is able to diagnose a prostatic cancer or infections. And we also do uroflowmetry, that is actually a speed of the urine with which the individual passes. That will tell us a rough guide about the level of the obstruction. And also we can do a MRI if you are suspecting a prostate cancer.
Is there any association of benign prostatic hyperplasia and prostate cancer?
This is a lot of controversial topic. As such, there is no association of BPH and prostate cancer. So BPH patients who have symptoms of BPH can be in harbor a prostate cancer inside their prostate. The prostate cancer diagnosis requires a digital rectal examination where you can feel the prostate as a hard nodule, and also we can have a PSA levels which usually will be elevated in a prostate cancer.
What are the treatment options available for patients with benign prostatic hyperplasia?
Based on the symptoms levels, we classify BPH into mild, moderate, and severe. And mild symptoms can be treated with a just observation, whereas moderate symptoms require, say, tablets, which might have to take a lifelong based on the symptomatic improvement. Severe symptoms, where there are some indications where like patient is having a hydroureteronephrosis, where that means that urine is going back into the kidney, and patient has a bladder stones, urinary bladder, multiple stones, and patient is having a blood in the urine recurrently in spite of the medical tablets, and also patient is having a recurrent infection. These are all the things and indication for surgery. There are plenty of options are available for prostate surgery. One is normally done surgery is TURP, that is transurethral resection of the prostate, which is done using an underwater cutting current. And we also can use laser, and that is what calls HOLEP, laser prostatectomy. And also newer modalities like prostatic stents. We also call it as iTind, Urolift. All these things are available. And new block in the kit is RESUM, that is water aquablation. The advantage of water aquablation is done in a shorter period of time. It can be done under local anesthesia, and it is usually done on an OPD setting. These are the various treatment options available. In spite of this, if there is a prostate is very large, and we can still do a open robotic or a laparoscopic open prostatectomy. These are the different treatment options available for a BPH. Correctly, it is called as BPE, not BPH. It is benign prostatic enlargement, not a benign prostatic hyperplasia. Thank you.